Hi guys, welcome to episode 1 of our antenatal education videos. So as promised, today we're going to be talking to you about the different birth areas that we have to offer at Princess Anne Hospital. So we're going to get started with Heather, who you haven't met before, so I'll pass over to Heather now.
Hi, I'm Heather. I'm one of the midwives who works largely in clinic at the RSH, doing lots of antenatal care for women, but I do also work on the labour ward and in the birth centres as well. So the first place that I'm going to talk to you about in terms of where you can give birth is right in the heart of Princess Anne Hospital, which is our labour ward. So it has a multi-speciality consultant-led care. So if you have a slightly complicated pregnancy, or if you're in one of our other birth areas and your labour becomes slightly complicated, or we've got concerns about your well-being or baby's well-being, it may not have been your chosen destination, but that might be where we end up caring for you. Although it is obstetric-led, it doesn't necessarily mean that you are strapped to a bed, that you have to have a CTG, that there's going to be lots of intervention. You can still make that birth environment your own with sort of your own lighting, your music. We can be in or out as much as you need us to be, but obviously there are times that we'll need to be in the room more often than not, especially if we're wanting to keep a close eye on you and on baby as well. So in order to find labour ward, where you normally go to Princess Anne for your scans on level E, we're just one level down on level D. You'll probably see where the ambulances are parked just outside. So you go through the double doors straight up to reception, and you'll meet one of our really lovely ward clerks who you give your notes to, and then we'll call you around. Of course, if you do think you're in labour, please do not just turn up at labour ward. You do need to let labour line know. So you can call them. The number is in your notes. It's 0300 123 9001, and let them know that you think you may be in labour so we can assess you. So the facilities on labour ward, we have 13 birth rooms, and we also have a pool room. So if you were wanting to have a pool birth, it doesn't necessarily mean that you have to, like I said, be on a CTG or be closely monitored. You can still do that, and we'll facilitate that as and where you want. You can labour in the pool, but you don't have to give birth in the pool. You might get in the pool, but it's your dream birth and think, I hate this, and you can get out. That's fine, no problem. We're not going to stand there like, well, we've run it now. You can just get in, have a splash about. It's really good pain relief for some women, eases a bit of pain on their joints as well. There is also the induction suite, so if baby has decided that they don't want to come along on that due date, where only 4% of babies actually turn up on the date they're supposed to, we do have an induction suite where we can help get your labour going with a number of different things, which we'll talk about in some later videos about induction. There's a recovery area as well. So if you have needed to have a caesarean birth for any reason, whether that's pre-planned or whether that happens during your labour, you can go to theatre, and then when you come out of theatre, if you're not able to go back to the labour room that you were in, you can go back to our recovery area. We've got lots of highly skilled midwives who'll be looking after you there as well, making sure that both you and baby are well, and of course helping to facilitate your feeding as well, whether that's breastfeeding or formula feeding. We'll make sure that you've got that support when you come out of theatre. There is a high dependency unit as well that we have there with, again, really highly skilled midwives who are looking after your every heartbeat, your every respiration rate, making sure that you are okay, and if there needs to be any extra intervention, they'll be looking after you there as well. There's a number of reasons why you would be already destined for labour ward, and if you're not sure about your place of birth, when you have that birth chat with your midwife at 36 weeks, make sure that you've had a look at some of the links that we're going to be posting in the video so that you know what is probably going to be right for you in your pregnancy, because we're not categorizing women into where they should be. We're saying, here's the information, here are the options, what do you think about it, so that we can formulate a plan with you together and make sure that we are trying to facilitate your choices as much as is sensibly possible so that you can do that. But there's nothing to be afraid about of labour ward, and later in one of the videos, I think Laura's going to be doing a bit of a walk around Labourland so that you can have a real look at the facilities, ask some questions, and yeah, you don't need to worry if you're going to labour ward. Everybody's absolutely lovely there. We've got lots of posters up on all of our birth walls that say now is the time to ask. So if somebody sort of bundles into the room and says, hi, I'm blah, 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 and you don't hear, and they say, this is what we're going to do, and you're not sure what they've said, please feel free to stop us and say, I'm sorry, can you just repeat your name, or can you just ask that again? So that's sort of the overview of labour ward. Obviously, Other reasons you might want to transfer, they have the anaesthetists on site. So if you want to use the pain relief options of remifentanil, for example, the drip that goes into the back of your hand that you control, or if you wanted to have an epidural, then obviously labour ward is the place that you would need to go. So if you were on one of the birth centres, or even if you're at home, you're able to transfer to labour ward, and we will facilitate that as soon as possible. I know there's been a lot in the press recently saying that midwives are stopping women from having epidurals, or saying, no, it's too late, or you can't go through. As soon as you want it, you tell us and we facilitate it as best we can. I think the only time I've ever told a woman she can't have an epidural is when I've seen the top of her baby's head coming, and that is really too late for an epidural, because baby will be born by the time the anaesthetist gets there. But it's a really good facility. You can still make that birth environment your own. So have a think about it. If when you're making your birth plan, that you've got several options. You've got, if I have a straightforward birth, this is what I'd like to happen. If I need to have a cesarean birth, this is what my plans and my options are for that as well. So that's about it for labour ward.
Lovely. Thank you very much, Heather. I'm going to speak to you about Boardland's Birth Centre. We are a midwifery-led birth centre on E-level at the Princess Anne, just up one floor from the labour ward. You will see Heather and Laura and myself on Boardland. Most of us rotate around the place depending on where women need us to be. We have 6 birth rooms on Boardland. 2 of which are fairly large pool rooms. We have beautiful pool rooms. They're decorated really nicely. It's a nice home from home kind of feel. It doesn't have the machines and the bleepy noises and bright lights that you might associate with the labour ward. It's a bit more of a home from home feel. 4 of our birth rooms don't have a pool in, and 2 of them are ensuite bathrooms. And sometimes we have the facility where women can stay in a single room postnatally after their babies are born. We also have a 4-bedded postnatal bay where women can stay after they've had their babies, where we can give lots of breastfeeding support and any kind of parent craft support that people may need. We have a nice lounge as well where your visitors can come, so that you're not all in the bay, obviously, because it's a shared bay. If visitors come and you've got a nice sunny lounge where you can have your breakfast and lunch and dinner, and there is a television in there where you can watch telly if you want to whilst you're breastfeeding, or just chat with the other women. It's quite a nice sociable community on Boardland. We tend to try and really encourage people to interact with each other. What else can I tell you? What do we offer on Boardland, first of all? So Broadlands and the New Forest Birth Centre both offer an aromatherapy massage service, and that could be either a post-date aromatherapy massage. So if you go overdue in your pregnancy, and we all get a bit fed up during this stage, you know, the baby's meant to be here now, we can offer you this aromatherapy service, and we run a clinic, usually once a week or once every fortnight, depending on demand. And you can have a nice 20-minute relaxing massage, and the oils that we use are known to promote your uterus to start contracting and help you relax, which of course is what you need to do before you can go into labour. We do that at Boardland and at the New Forest Birth Centre, so you can speak to your midwife about that. With regards to pain relief on Boardland, we can hire TENS machines from Boardland, which are the stickers that go on your back and you hold a button. We'll talk to you a lot more about that in episode 3, I think, when we're talking about the first stage of labour. So we'll talk about the TENS machine a lot then. We can offer obviously paracetamol and dihydrocodeine, and possibly some Oromorph in the early stages of labour if you need it. And then once you're in labour, in established labour, we can offer you gas and air, which is Entonox, which is via a handheld mouthpiece, if you like. You breathe it in and out, it works quite well. A little bit like having a glass of wine or 2, just in one puff, which is quite nice. And along with the Entonox, we would then offer the use of the birthing pools, which Heather said earlier is really good pain relief. It's not like having a bath, You know, lots of people say, well, I had a bath and that didn't help very much, but actually the pool is very different. It's much deeper. It can take your weight, and it's warm and comforting, and you can get into some really good positions that you might not be able to get into on dry land. And that's really, with regards to pain relief, that's really what we offer on Boardland. Actually, pethidine, I forgot to mention pethidine. There is always a place for pethidine. Lots of people think, oh no, I don't want to use pethidine because it's going to transfer to the baby, and they're absolutely right, it can transfer to the baby via the placenta. But it really does have its place in early labour if you've been having a really long latent phase, which we'll be talking about in episode 2. Pethidine is maybe something to think about, just to give you a little bit of a rest, a little bit of a break, time for your body to have a rest before you start labouring. So you can have that on Boardland Birth Centre as well. And that's about it for Boardland. Thank you.
So I'm going to talk about the New Forest Birth Centre. So the New Forest Birth Centre is a midwifery-led birth centre, but it's freestanding. So what that means is it's outside of the main hospital site. So it's down in Ashurst, just behind the Happy Cheese pub. So it's in a really beautiful setting out in the New Forest. So it's for women who are experiencing uncomplicated pregnancies, and the same goes for Boardland's Birth Centre. So it's for women who are between 37 weeks and 41 weeks and 5 days, or for postnatal breastfeeding support. So if, for example, you've given birth on labour ward, but actually you feel like you need some more breastfeeding support, you can ask the midwives in the Princess Anne if you can transfer to the New Forest for that support and stay a couple of nights to make sure that you're definitely happy with feeding before you go on home. So how it's normally staffed is it will have 2 midwives, so a midwife like Amy, who's a band 7, and then a midwife like myself, who's a band 6, or like Heather, who will actually be providing the labour care. We also have 1 maternity support worker on shift as well. They're senior maternity support workers out in the New Forest, so they're really, really great. They come in and help us during births. You know, we're so lucky to have them all. And then also in the building, we have lots of other antenatal clinics and postnatal clinics going on as well. So there's often lots of staff in the building, especially during the daytime. So the New Forest Birth Centre, as I said, it's in an absolutely beautiful setting. It's behind the Happy Cheese pub, who actually will let you take out food. So after you've given birth, you can order some dinner from the Happy Cheese pub and bring it back to the New Forest Birth Centre and eat it in our beautiful lounge that we have there, with yourself and your birth partner and your new baby in its cot. And there's free parking. So I don't think anything else about that. Now, Amy mentioned about the fact that we do have aromatherapy out at the New Forest. We also have 2 pool rooms, and there are only 2 birth rooms at the New Forest Birth Centre. Now, most women at the classes normally ask me, oh, are they often both in use? And I normally say, no, they're not normally both in use at the same time, and it's not normally a problem coming out to the New Forest Birth Centre with regards to it being full. We also have a 4-bedded postnatal bay, which is where you will go once you've had your baby. So you'll give birth in one of our birth rooms and then be moved around to the ward area, where you can stay as long as you need to. We also we can hire TENS machines, and we also have paracetamol and dihydrocodeine tablets that we can give you, which are oral. Normally we would give those in the latent phase, and of course we have gas and air plumbed into the walls as well. So as Amy mentioned, the pool and the gas and air is a really, really good combination of pain relief in labour. Now I'm just going to bring up some things on my screen just to show you about the New Forest Birth Centre. So one thing that your midwives may have told you about in your appointments is about this app. So this is My Birthplace app. And this is a really, really great resource for you and your birth partner to sit and have a little look at. So on here, it will take you through the midwifery-led care centres. So I've just talked to you about the New Forest Birth Centre, and then we've got Boardland's Birth Centre featuring Amy a few years ago. And you can go and watch a little virtual tour. because unfortunately we don't normally provide tours of Boardlands and labour ward, and especially not in the current circumstances. So please go and have a look at these videos. And really great resources as well are our Facebook pages. So we've got, this is a New Forest Birth Centre one, and the New Forest Birth Centre often posts every month little pictures of our washing line of babies that have been born that month. So this month must be Easter eggs, I reckon, because it's.
I reckon it is, yeah.
So then once, if you've had your baby there, then we'll put your little Easter egg on the tree with your baby's name and birth weight on it. But New Forest Birth Centre really holds a special place in my heart. It's absolutely beautiful out there. So yeah, I hope you guys enjoy watching the video on it when you go onto my birthplace.
I'd like to just go back to Boardland's Birth Centre. As Laura said earlier, it's exactly the same as the New Forest Birth Centre when it comes to criteria to birth there. So low risk women with no complications in their pregnancy. It's a midwifery-led environment. So although we are in the hospital, we are still a midwifery-led environment for low risk women. We do, however, and have for the last year or so, been looking after and supporting women who need IV antibiotics for GBS, or have maybe had a cesarean section in the past but would like to have a vaginal birth after cesarean section now. With women who have had a cesarean section before, we can set up a meeting or a telephone call with the consultant midwives, and a plan is put in place for you to be able to come to Boardlands rather than go to the labour ward. Now, this is on an individual plan, and it's very important to talk about risk factors and whether that environment would be safe for you. But we certainly have been supporting women to come to the midwifery-led areas in those situations. So if you're one of those women, then please speak to your midwife, and we can organise a consultation with the consultant midwives to get that plan in place for you. I just forgot that little bit whilst I was talking about boarding. Sorry. So I now want to go on to talking about home birth, and home birth is a hot topic for us at the moment. In Southampton, we actually had 15 home births in March, and we believe that that's because women are choosing to stay at home rather than come into the hospital to have their babies during this period of COVID-19. I'm sure many of you may have seen the video that went out on the Southampton Maternity Services web page last week about our home birth service and the fact that we are continuing to deliver that. Round about 2% of 2% of babies in England are born at home. That's roughly 1 in 50 births. And of course, we've seen that shift from the 70s, where most babies were born at home, to this period of time now where only 2% of babies are born at home. That may be a cultural thing that we're not sure where that comes from, but the shift to hospital birth happened around about the 70s, 80s, and has kind of continued that way. There are several advantages to being at home when you're having a baby. If you are having a low risk, uncomplicated pregnancy, there is no reason why you can't choose to stay at home during your birth. It's quite relaxing being in a familiar place, being able to wander around your garden, make a cup of tea in your own kitchen, use your own bath if you need to. It's to go into labour and have the labour progress nicely. You have to be relaxed, and your hormones need to be able to flow. And sometimes being in your own home makes you feel nice and relaxed. Obviously, if you're not somebody who would feel relaxed at home, then that might not be an option for you. But certainly some people would rather stay at home. There's no need to travel to the hospital, so husband doesn't need to worry about whether it's rush hour traffic getting to the hospital, and sometimes it's just nicer for us to come to you than it is for you to have to worry about getting through the traffic to get to us. Also, if this isn't your first baby and you have children at home, you don't need to worry about childminders or where the children are going to go when you come into hospital. The children can stay in the house. Some women and families like their children to be around for the birth experience. Other women, they want their children to be in a different room or not be around. That's completely personal preference, and that would be up to you and your family to discuss. We know that if women are low risk and healthy and they're having a baby at home, that they are less likely to have intervention in childbirth. And when I mean intervention, I mean breaking of the waters, or having to have any kind of intervention like the syntocinon drip or forceps or Von-2s, that type of thing. Women who choose to stay at home generally have less intervention and good outcomes. The likelihood of complications, there has been some research done, the birthplace research that was done a couple of years ago, that suggests that if this is your first baby, there is a slightly higher chance of neonatal baby complications. I think I've got the statistics here, 9.3 per 1,000 births, as opposed to being on an obstetric unit, which is 5.3 per 1,000 births. Now, last year, a systematic review was carried out, and new evidence comes to light that actually the chances of a first-time mum and a second-time mum having neonatal complications is actually the same. Obviously, you'll want to have a look at that evidence yourself, and I'll happily put the link in the comments when this video goes out on Monday. I'll put the link in so that you can have a look. But certainly all the information that you'll get from our website and the Birthplaces app will allude to the statistics that I've just given you. But as I said, the new evidence suggests that there might not be a difference in that outcome. So pain relief at home. Pain relief is available really very much the same as the birth centres, really. You can still have the dihydrocodeine at home. What generally happens if you are in the latent phase and you're requiring analgesia is that you would come into the hospital maybe and have some oral morph or some dihydrocodeine, and then you would go home again. If that happens, there's no reason why you still can't continue to stay at home. We'll send midwives out to assess you once your labour starts to ramp up a little bit more. Obviously, a paracetamol and a bath at home in those early stages of labour is really good. You can also hire a pool. So there are plenty of companies out there who hire pools for home use. You just have to make sure that you're able to keep the temperature of the pool, body temperature 36.5 to 37.5 degrees, and have the means to, excuse me, be able to do that temperature. And we do that very regularly to make sure it stays that way. You can have Entonox at home. The midwives will bring Entonox with them. Aromatherapy massage, we can do that at home for you. The midwives can bring out some blends so that you can use those in labour. And obviously movement and mobility at home. You know, it's your own home. You can move around, use the stairs, go out in the garden. Movement and mobility is really good distraction for pain relief. So transfer into hospital from a home birth can vary very, very much. For first-time mums, the transfer to hospital is actually quite high. You can have a little look at those statistics on our website for transfers, which we'll also put a link on for you, so you can have a look at those. The reasons for transfer for first-time mummies are usually for pain relief, because of course if you're a first-time mum, you've never been through this process before, you're not sure how the pain is going to be, and sometimes during labour you will want to opt for different pain relief, and that's totally fine. You can do half of your labour at home and transfer in for pain relief, that's not a problem. The midwives will go with you and continue to look after you in the unit. The other reason might be progress of labour. So if your labour, this actually goes for any of the midwifery-led environments. If a transfer for pain relief or progress in labour is needed, then obviously that transfer happens regardless of where you are. But at home, sometimes the midwives will just be a little bit more, they'll be they'll be really monitoring you and the baby very closely. And if they feel that your labour isn't progressing in a way that is normal or perceived as normal, then they would have that discussion with you and talk about your options, and then possibly transfer in depending on what you decide to do. The other reason might be if we were worried about baby. So if the midwife was listening to the baby's heartbeat and it wasn't quite as we would expect, then it might be that we would need to transfer to the labour ward so that we could monitor the baby a little bit more closely. Midwives are experts in normal labour. We look after women in normal labour all the time, and we keep a very close eye. We listen to the baby every 15 minutes, every 5 minutes during the second stage of labour, and we'll be monitoring your observations all the time. And if at all that anything goes off the path that we are expecting it to go, then a conversation will happen, and a rediscussion around place of birth will happen. Obviously, women who have had babies before, the transfer rate is less for those women because their labours tend to be much quicker. And if they've had a baby before, the chance of complication is less. So yeah, that's a little bit about transfer. Like I said, I don't want to bore you with numbers during this video, but we will give you the link so that you can look at the transfer rates yourself, and that can be something that you can incorporate in your birth-based discussions with your midwife. Also, if you have any questions at all, please just speak to your midwife because she can advise you further. Okay.
I just want to add about transfers. So a question that I often receive when I'm doing my antenatal classes is what the transfer time is from the New Forest Birth Centre, because understandably the fact that the New Forest Birth Centre isn't on site at the Princess Anne does elicit some anxiety in people, and that's very, very normal and very, very natural. And what I say to women is, as Amy said, as midwives, we are the professionals in normal birth, and we are constantly observing you and your baby to make sure that you're safe and safe to remain with us at the New Forest Birth Centre or on Boardlands or at home. But if we do think we're going to need to go to the Princess Anne, to the labour ward, to have input from an obstetrician, then from the time that we make that phone call to the ambulance service and getting to the door on the labour ward, it tends to be in total about half an hour. In that time, we're obviously getting you ready, waiting for the ambulance to come, getting everything sorted out, making sure, you know, we've got you all covered up and ready to go and got your dignity intact before you get into the ambulance, sorting out your partner, getting him in the car and getting him driving down the road safely. So actually, it's not a huge amount of time that it takes to get you from the New Forest Birth Centre to labour ward. And, you know, if I was the midwife looking after you in labour, I would stay with you, I would go with you in the ambulance, and I would continue looking after you on the labour ward. So you're not left alone at any point. You will always be with a midwife. And midwives, we are all trained to deal with all emergency situations until we can get you to a place where there's an obstetrician.
And it is quite similar, isn't it, from the Boardlands Birth Centre to transfer down to the labour ward as it is from the New Forest, because we still have to make that phone call to labour ward to let them know that we are intending to bring somebody downstairs because we've got some concerns about their progress or baby's well-being, or they are requiring extra pain relief. So we still need to be able to facilitate that transfer. So there isn't a huge amount of difference transferring between the two birth centres. So do have a look at the New Forest Birth Centre, because as Laura said, it is a really beautiful environment in which to give birth, and we don't want that to be too huge of a concern for you when you're choosing your place of birth.
And with regards to transfer again from home, if that was needed and we did need to transfer, the ambulance service are on board with coming out to home births. In fact, sometimes if we're concerned about something, they will come, and if we need them, great, we need them and we transfer. If not, they just go away. And actually the ambulance service are very good at responding to that. Obviously it depends where you live as to how long the ambulance takes to get there. So we can't guarantee a time, but it usually isn't very long at all if we need to get a transfer in quickly. The other two reasons that we may need to consider transferring in from a home birth would be if we had concerns about the baby. So maybe if there was meconium in the waters when the baby was born, It might be that the baby would need some observation, a little bit closer observation, and that would need to be done in the hospital. Or maybe if you needed some stitches after your baby was born, 9 times out of 10 those stitches will be able to be done at home. But occasionally, if it's a little bit more complicated than that, then we would transfer in to have those stitches done. But there's no reason why you can't return home as soon as that's done in the hospital. I just really want to reiterate the benefits, the benefits for you and for baby of having a baby at home, especially during this really uncertain time. You know, you are less likely to have intervention in your labour, and the outcomes are good when you have a baby at home. The outcomes are no different. So I just wanted to leave you with that thought on home birth.
And I think the same can be said for, you know, the New Forest Birth Centre and Boardland's Birth Centre and home. Women who are experiencing uncomplicated pregnancies, you are more likely to give birth normally. So that means vaginally in these areas, and that is because you are being looked after by a midwife who is the specialist in normal birth. You know, we're having all the lights down low, we've got candles lit, we've got your own music on, so you feel nice and relaxed. And we're going to talk about the importance of being relaxed and feeling calm and safe in our next video. But you know, the statistics do really show that giving birth in the midwifery-led environments do lead to better rates of normal vaginal births than, say, if you went directly to the labour ward as an uncomplicated lady. And
initiation of breastfeeding as well, actually, in the midwifery-led areas. You are more likely to be successful in initiation and continuation of breastfeeding. That also has come out in the evidence as well.
I think that's also linked, isn't it, to where a birth has been complicated, or the the actual birth has led to somebody not feeling as awake or as physically able to facilitate that breastfeeding. It's not that, oh, you're going to go to labour ward, so you're not going to breastfeed as well. No. It just means that when you're on labour ward, it's more likely that you've had a complicated birth, or maybe have had some birth trauma which is affecting you. And when we talk about feeding, which we will do, Claire will do this in really brilliant detail in a later video, don't be too hard on yourself. Understand that your body's gone through something, and when you're on labour ward, it's probably because that was predicted rather than, oh, you're there, so this is what has happened. So yeah, be kind to yourselves as well.
Definitely. Now, before we end, I just want to quickly bring up that screen again, just to reiterate the important things that we're going to post links to. So we've got, as I mentioned before, we've got the My Birthplace app, which is the one that your midwives will always encourage you to have a look at, which is on the front of your maternity notes. Mm-hmm. And obviously your maternity notes are the blue notes that you should be carrying around with you at all times. Now, another really important one that we always direct you to is the Healthier Together app. So this is the page which has so much helpful information on all about different parts of pregnancy. So please, please, please have a look at that one as well.
It's such a good resource, that website.
Yeah, definitely. And then Amy mentioned a bit about the Birthplace in England research programme, which was the piece of evidence which actually showed that, you know, uncomplicated women are best placed to have a nice normal vaginal birth in midwifery-led environments. So that's that study which we'll post up for you guys. And then obviously we've got the Boardland's Birth Centre page, we've got the New Forest Birth Centre Facebook page, and the Labour Ward one as well. So please make sure you're following all of them, because they post really, really great stuff. So this is our March stats for Labour Ward, and it says about our amazing 15 home births as well. So we'll post all of this stuff for you to have a little look at yourselves, because it's really, really very interesting.
Okay, so there we have it. Episode 1 is done. Any questions at all, please just write your questions on the link and we will do our best to answer them all for you. Nice to see you.
That's great. Thank you.